Good afternoon, nursing team providers and clinic managers. My name is Chantel Jones, and I come to you this afternoon with informative information on the complexity of sex and gender as they impact a specific group of healthcare professionals today. I believe it's correct to say that the complexity of sex and gender affects a particular group of healthcare workers, such as yourselves. Every day, U.S. healthcare professionals interact with different groups of individuals to provide excellent care. In order to do this, we need to understand our patients and the importance of gender based medicine. When we look at sex and gender in healthcare, we have to ensure not to confuse the two. The words sex and gender are commonly used interchangeably, but many who study language will argue that their usage is very different. To properly address the difference in healthcare between men and women, it is necessary to distinguish between sex and gender and their individual effects on health. Sex differences are based on biological factors. These include reproductive function, concentrations of sexual hormones, the expression of genes on X and Y chromosomes and their effects, whereas gender is associated with behavior, lifestyle, and life experience. It is often not easy to separate the impact of sex and gender. Sex impacts health by altering behavior, testosterone. For example, it causes aggressive behavior associated with risk seeking and neglect of personal health. While with gender, behavior can change biological factors and therefore health. It causes exposure to stress, environmental toxins, poor nutrition, or lifestyle choices. These changes and their psychological effects are different in women and men, as genetic code and non genetic structures are modified by sex hormones. This is why gender based medicine is important. It takes into account the effects of both sex and gender. Gender medicine aims to include biological and sociocultural aspects and their effects on women and men to improve health and healthcare. Gender medicine considers the needs of both sexes. This might require giving greater attention to women where certain data on women is insufficient and greater attention to men where certain data is insufficient as well. For example, more data on men are needed in regards to depression. At the same time, more data on women is needed in the area of maybe cardiovascular heart disease. When we speak on gender, we also look at our LGBTQ population, our lesbian, gay, bisexual, transgender, queer. These individuals have gender identity, gender expression, or behavior that differs from their biological sex assigned at birth. Doctors and therapists struggle to give these patients the best medical care because of their lack of expertise and experience. LGBTQ patients often require medical interventions such as hormone therapy or surgery. Treatment of this is not taught in conventional medical curricula, and too few physicians have the requisite knowledge and comfort level, and we need to change that. Because sex and gender affect a wide range of psychological functions, they have an impact on a wide range of diseases, including those of the heart, lungs, and immune systems, as well as others. Men and women are alike in many ways. However, there are significant biological and behavioral differences between the two genders. These differences affect manifestation, epidemiology, and functional changes occurring within an individual due to many prevalent diseases with the approach to healthcare. In spite of our knowledge of these significant differences, there is little gender specific healthcare. Due to this, there is no prevention, management, or therapeutic treatment of many common diseases that do not reflect the most critical and most important risk factor for our patients, which is sex and gender. This oversight is holding back more efficient healthcare, as gender based prevention measures or therapies are probably more effective than the usual approach and would benefit patients of both genders. Addressing gender in healthcare requires new approaches at many levels, from training medical personnel, epidemiology, and drug development. Despite the loads of data on differences, medical practice does not sufficiently take gender into account in diagnosis, treatment, or disease management. New approaches aim at education and increasing awareness. Education and increasing awareness is very important for our patients, for our nursing staff, for our providers, and our clinic managers. Training and educating our staff on why we're doing something helps them better understand and educate the patients in the process. I want to thank you for your time, your patience, and your attention this afternoon. Again, my name is Chantel Jones. Thank you.